Hello and welcome. You can see you have reached the virtual fireside chat here at Harvard Medical School Executive Education in this topic, lifestyle skills for health, wellness, and career. We are joined here by Dr. Beth Freites, who's a clinical assistant professor at Harvard Medical School, as well as the president of the American College of Lifestyle Medicine. We're also joined by Ranil Harath, president of Emeritus Healthcare. So with that, we invite our speakers now into the gallery view. Thank you again for being here, and over to you.
Thank you, Marie, and welcome everyone. Today is an exciting session, and my name is Ranil Herath. I'm the president of healthcare at Emeritus. I'm thrilled to be hosting Beth Freites today for the fireside chat on lifestyle skills for health, wellness, and career. Lifestyle medicine is a fascinating space to me personally, and I know it is broadly as well. It's growing rapidly, and it is an area of medicine that really focuses in on helping people lead healthy lives, prevent disease, and even help treat some chronic conditions. So, if you are a health enthusiast, parent, coach, fitness professional, physician, nurse, fitness trainer, or other healthcare provider who is just simply interested in well-being, this could be a great session for you. And I believe it's going to be quite the treat. Now, before we get into the topic, I do want to spend some time on the amazing background of my guest, Dr. Beth Freites. Beth, welcome.
Thank you so much for having me. It is a delight and an honor.
Could you talk a little bit about your career journey and the different things, experiences, and the education you gained along the way in order for you to be recognized as an expert in this field?
Thank you. I'd love to share it. So I would need to start by telling you that I always wanted to be an entrepreneur. And when I was young, my purpose in life would be to follow in my father's footsteps, who was an entrepreneur. In fact, his father started a business in New York City, financial advising, accounting, and I love numbers. So I wanted to follow the path of the family and take that over. And it was in my college years when I was at Harvard. I was a freshman, going to be an economics major and going to take over the business. And so I got my books and I want to tell my dad. I want to tell him how excited I was about the process. So we didn't have, of course, cell phones. My dorm room phone wasn't working, so I used the payphone. Made the call home to New York, Scarsdale, New York, and got my mom. And I said, hello. And the first words out of her mouth were, "Your father loves you very much." Now that's a little odd, Ranil, because I know my dad loves me. And that's just a strange way to start a conversation. So I, of course, said, "What are you talking about? What's going on?" And in that moment, I learned my dad, who was 52 years old, had suffered a massive myocardial infarction, heart attack, and a subsequent middle cerebral artery infarct, stroke, leaving him paralyzed on his left side. It was that moment, that day, where I was introduced to the field of medicine. And I had not been introduced except for pediatrician visits and vaccinations. That's about all I knew about the medical field, because no one on either side of my family, mom or dad, was in the field of medicine in any way, shape, or form. My mom's side, they were Greek immigrants and they ran a restaurant, worked really hard in East Boston at the spa. And so I was entrepreneurial until this day, until this moment in time. When I saw my mentor, my hero, my pillar of strength and wisdom, unable to really communicate, and it was life-changing, obviously for him and also for me. And I remember really very vividly recalling this story to you right now, going to White Plains Hospital as if it were yesterday, and it wasn't. It was a long time ago. And walking into that room and seeing him with what was to me just tubes everywhere. Of course, I know now it's nasal prongs and a few IVs, but he was in the Johnny and looking so ill that we were all just crying. It was just my mom, my brother, and I with my dad. And we were all crying because we had no understanding of what had happened, why it happened, and what was the next step. And then we had a family physician who was my physician, everyone, my brothers, my mom's, my dad. Dr. Moses was his name. And he came in and saw us all. And he asked if we would leave the hospital room and go into a family meeting room, which the three of us did, leaving my dad to rest. And Dr. Moses, explained to us exactly what happened. I was riveted. He explained what happened. He explained he could recover. He said it would take a long time, about a year, to get motor movement back and to make a recovery. And then he gave me the job of working my dad's hand with a ball. And whenever I saw him, I would check in with his hand therapy. And that made me feel like I had some power, some control. So Dr. Moses was brilliant. And he's the one that inspired me, right, to even go into the medicine. And then watching my dad work hard, the recovery process in and of itself, that he could walk again, talk again, use his arm again. Now, fine motor movement of his left hand did not come back fully, but that's the only way you would have known. But otherwise, you would not have known this man had a heart attack or stroke. The best news was he made a complete recovery, but he made a complete lifestyle change. And there became the next fascination. I was just fascinated to learn that he needed to change the way he ate. He needed to start exercising. He needs to reduce his stress. And he went to this place, in your honor, Ranel, I pulled this out. Pritikin. This is his book from the 80s. Nathan Pritikin started these first lifestyle medicine centers, intensive lifestyle medicine centers. He himself, Nathan Pritikin, had a heart attack. He was not a physician. He was a physicist, chemist. He was a researcher. And he, after having his heart attack and stroke, researched how you prevent one. So he published this, I'm looking, 1979. And my dad followed this program. He went residential with my mom back in 86, learned how to eat healthy. So suddenly, Ranel, vegetables appeared on our plate. My dad was all fast food before this event. And suddenly we had broccoli, we had lettuce, we had salads, we had eggplant, things I really hadn't eaten before his transformation. And he was exercising 5 days a week, 1/2 hour on his exercise bike. Sure, he was listening to some Dow Jones, I don't know, some important financial reports by the radio, but he was on that bike.
So that's an awakening. And then subsequently, you got fascinated by the impact you can have. And that kind of sets you off on this trajectory. And talk about a little bit about education and work-wise. How did you gain the experience in lifestyle medicine?
Yes, it's so critical because back in the 80s, there was no lifestyle medicine, actually. Yeah. So when I was in Harvard, what was starting to come out was mind-body medicine by Herb Benson. He had the relaxation response, and he was trying to inform all of us in the medical field that the mind had a lot of power and could impact the body. And it was an article in 1988 that was published in New England Journal of Medicine by Rosansky and colleagues about mental stress in the heart. You need to know that lifestyle medicine, which came into fruition in 2004 as the American College of Lifestyle Medicine as an official academic area, it didn't have any formal grouping back in the 80s. But the nutrition, the exercise, and the stress resiliency all had their camps. So I was fascinated with this stress and the heart camp. And in fact, my whole senior thesis was replicating Rosansky's article, meaning I went to New York Medical College, and we did the same experiment Rosansky did. So we had cardiac patients who did serial sevens. What does that mean? They took 100, subtracted 7 again, 7 again. So it's mental stress. People don't like this. I don't know if anyone on the line enjoys doing serial sevens, but when you're put on the spot doing your serial sevens, it actually creates a lot of mental stress. And we know it impacts the heart because I saw it with my own 2 eyes, and we published this, and Rosansky published it before. So you get EKG changes. You can have ischemia. You can have lack of oxygen to the heart muscle because the coronary arteries can close down from mental stress. Now, these patients were going into the hospital because they had heart disease and they were going to do physical stress. They were going to do their biking or their running on the treadmill to check their heart, but they opted into this experiment and they had mental stress. And we found the same changes are created with mental stress as were created with the physical stress on the heart. Now, this was in the 80s, really mind-blowing. And it was part of the reason that I wanted to continue to pursue medicine. So then I went to Stanford Medical School, and there, the same thing. I wanted to understand the science. This is all about the science, lifestyle medicine is, and this health and well-being. We're going to look at the body, the molecules, the cells, and understand how what we eat impacts our cells. And this comes from John Cook, who was a physician cardiologist who studied how diet can impact endothelial cells. Those are the cells that line the blood vessels. Very important. When they're unhealthy, then we can develop plaque, buildup of cholesterol. So when I worked with him at Stanford and the research we did, the bench research, we looked at diets high in L-arginine, like a walnut diet. L-arginine turns to nitric oxide. Why do we care about that? Because when the endothelial cells have nitric oxide, they're healthy and they can dilate and let blood flow. So we learned, comparing a diet high in, say, walnuts, high in L-arginine versus saturated fat, the diet that's high in L-arginine has healthier blood vessels. So right from the get-go, this is now 1992 and 93, I'm saying and seeing with my own two eyes what I put in my mouth, what one puts in their mouth, what we all put in our mouth has a direct impact on our cells. So at that time at Stanford, remember, there was no lifestyle medicine, no such thing to go into. Preventive medicine was about epidemiology at that time. Now it is more about counseling and doing the work of lifestyle medicine, actually. But back then it was not. And I was not here. My purpose in life, I learned, was to help people to thrive with a healthy body,
Right.
peaceful mind, and joyful heart. So for
That's
me, physiatry is what I went into. Now, not psychiatry. People get it confused. It's very common to confuse these. Physiatry is trauma to the central nervous system, the brain, the spinal cord. So I went into stroke in physiatry to try to help patients prevent strokes. That's how I got, that was my training. And then it was writing the book, Renil, about how to prevent a second stroke after residency in 2006 that I got into lifestyle medicine, because I studied on my own nutrition, exercise, stress resiliency, and wrote all about it in this book. And then a colleague of mine, Eddie Phillips, he's also a physiatrist. He was an attending when I was a resident. He read the book and he said, Beth, you're doing lifestyle medicine. Let's start the Institute of Lifestyle Medicine at Harvard. And Renil, that was it. Boom. There was the beginning of lifestyle medicine in my life and my whole history of science, research, know the biology, know the molecular mechanisms behind your recommendations, was allowed to flourish into this area of lifestyle medicine.
Could you briefly give an overview of what lifestyle medicine is, so that way the audience can be, you spoke about it. So I think in addition to what you already said, like give me a sense of lifestyle
Sure.
medicine, how do you weave that space and what it is and what it is not?
Yes, great. So lifestyle medicine focuses on 6 pillars: physical activity, healthy eating patterns, stress reduction, positive social connections, avoidance of risky substances, and sound sleep. Often missed pillar, but so important, how we sleep. And lifestyle medicine is a medical specialty where you can be board certified. So physicians can get special training in those 6 pillars and then be board certified after taking an exam. As I studied in this from the get-go and was one of the exam writers, and I'm still one of these exam writers to get the physicians board certified. And what does a board certified physician in lifestyle medicine do? Many are cardiologists, some are family practitioners, internal medicine physicians. So they're still prescribing when they need to prescribe medications, but ultimately their goal is actually to reduce the medication and to bring in the power of the prescription for physical activity, helping people reach the guidelines of 150 minutes of moderate intensity physical activity, of consuming a whole foods, not processed, plant-based fruits, vegetables, whole grains, style of eating that can prevent, treat, and in some cases reverse chronic conditions like heart disease, high blood pressure, diabetes, and even obesity in some cases.
That's excellent. I think the 6 pillars is really good. Now, the question is, there is so many buzzwords about diet, then there are experts on fitness, then there are experts on nutrition. How do you stay grounded based on what you hear out there?
Yeah, this is a great question. And so what we want to do is look at the research. You're not surprised because I shared with you my background, but this is the academic way to approach this. And this is the level-headed, grounded way to approach this. And if you are just going with what someone feels or sees, or one small study of 5 patients showed this, you may get off track. If you stay grounded in the research and you follow people, for example, I would say Dr. Walter Willett in nutrition, just for example,
Yes.
he is the chair of the nutrition department at the Harvard T.H. Chan School of Public Health, who has spent his entire career, so over 30 years, in the space of nutrition, knows the past history of the research, can evaluate the new research, and then can make judgments on it, and is always grounded. So if you can connect with, follow those people who are embedded in the research, then you will have a better chance of following guidelines that will lead you to a healthy body, peaceful mind, and joyful heart. So in the fitness world, looking at the American College of Sports Medicine, for example, there's also the National Sleep Foundation. If you're thinking, what about that sleep pillar? I've given you 3 things for the pillars. Social connection. I know we were reviewing them and I saw people got them, by the way.
Yeah, they did.
And there are experts in each of these pillars. Now, to be board certified, one of the questions here in lifestyle medicine, yes, MDs are board certified, and they would be board certified by the American Board of Lifestyle Medicine. International physicians are board certified by the International Board of Lifestyle Medicine. Someone said, if you have a PhD, can you be board certified? Yes, you can. You would take the examination and you would be board certified by the American College of Lifestyle Medicine. You would be a board certified PhD in perhaps behavioral health, perhaps exercise physiology, maybe nutrition. RDs, nutrition specialists, can be board certified in lifestyle medicine. They would be not a board certified physician, not through ABLM. They'd be board certified as a RD through American College of Lifestyle Medicine. And many people are board certified. We are a team approach, Ranil. If you're familiar with physiatry, where you have the physician, then you have the physical therapist, occupational therapist, speech therapist, dietitian, social worker, psychologist. In lifestyle medicine, we have a lifestyle medicine physician or the lifestyle medicine leader. Maybe it's a PhD board certified. Then you can have a health coach. Then you can have a fitness specialist. Then you can have a nutrition specialist. Maybe you need a sleep specialist or a stress resiliency specialist, depending upon the situation of the patient. Ever so important in lifestyle medicine to bring up something we have yet touched on, and I need to say it now, is the social determinants of health. So we might bring a social worker in, because we will be counseling patients one-on-one, helping them with their habits, their patterns, their attitudes, their beliefs, their resources. We must also think what's around the patient. What's the environment around the patient? What's the neighborhood look like? What is the cultural norms around the patient? What are the laws in that particular state or country? And we have to think about, beyond the individual, what is around and surrounding that individual. Do they have access to produce? If not, how do we counsel them about healthy, nutritious, delicious eating patterns.
That's brilliant. I just wanted to first congratulate you on a new program that you were leading, developing, and launching at Harvard Medical School on lifestyle medicine and nutrition. One question I have about the program is, the program it is catering to a very broad audience. So on one side, it could be a clinician, such as a family practitioner or a family practice nurse, to a fitness coach, a trainer, lifestyle coach. How could one program really effectively serve so many people? And talk to me a little bit about the program and how it can be effective in such a broad range or a broad spectrum, if you will.
Yes, absolutely. Go deep and broad with the question, meaning this lifestyle medicine, 6 pillars, the practices, the principles, the health coaching, the behavior change. This is information that I personally believe everybody needs. We have the Teen Lifestyle Medicine Handbook for a reason. If we learned about the 6 pillars of lifestyle medicine as teenagers, learning how to socially connect as teenagers, and learning the power of physical activity, how exercise could reduce our stress, how exercise could increase dopamine, norepinephrine, help us focus, help us learn, life would be very different. Now, there's the Teen Lifestyle Medicine Handbook. As I said, there's the Lifestyle Medicine Handbook. This is targeted at everyone. Physicians read it, absorb it, read about the patients and take that in. Mothers are reading it on vacation in the poolside because my friend took a picture of a mother reading the book saying, where'd you get that book? And the mom saying, I heard this is going to help me help my children and my parents. So Renil, this resonates with pretty much any human being who is living on this planet right now, because we need to get back to the foundation that Hippocrates set out. Let walking be your medicine. Food is medicine. We have the science behind it now to make sense of it, to make prescriptions out of it, and create guidelines that are research-based. So mothers looking to help their children, grandparents looking to help teachers, coaches, podiatrists, wound healing is essential. You need to have good nutrition. And guess what? Lack of social connection prevents wound healing. So all of these 6 pillars can have an impact for people that are looking for a healthy body, peaceful mind, and joyful heart. And most people want to feel that. They want to feel that they're thriving. So there's disease. And if we have disease and we have signs and symptoms of disease, we need to go to the doctor, sometimes to the ER, like my dad, when he had chest pain. You've got to get acute care in the hospital. Absolutely. Now, when you get to a place of lack of disease, lack of sign and symptoms of chronic conditions, and you're in a place of what they call neutral, what I want to do and what lifestyle medicine can do is take you from neutral to well-being and thriving. Now, mind you, lifestyle medicine can also take you from chronic conditions we already talked about, like diabetes and high blood pressure, to neutral. Sometimes you also need medication and interventions to do this, of course. Lifestyle medicine can help you get to neutral. And then to get to well-being and thriving, you're going to need these 6 pillars. So it resonates, Renil, with patients, with providers. Guess what? Providers are taking the same kind of classes that I'm doing for stroke survivors, Paving the Path to Wellness group coaching. Providers are doing it to help them because we are in a state of burnout and struggle with our healthcare providers, physicians, nurses, dentists, podiatrists, coaches, everyone on the line. So for their own selves, they're also embracing this information.
That's a brilliant point, Beth, because the caregivers, if you will, the clinicians, they're at a point of burnout, and burnout has been higher than ever. And while they are the practitioners, this also benefits them in how they think about their lifestyle, and for them and their families, for their teams, what is the extended care team. But it's fascinating to me that this being such an important area of healing and care for self and for your patients, for a clinician to a fitness trainer or a life coach, that it seems to be a notable gap almost, or it seems so. So I'm just curious, why is it there? It just hasn't been had the focus in any of these trainings, or why do we need a specific program like this to supplement each of these professionals?
So why is it not, Renel? That's the question. Because remember, medicine is a very old area. This medicine has been in existence, thank God, for a long time. And our power in the past was medicine, was antibiotics, penicillin, vaccinations. We came up with all of these important strategies to cure disease, surgeries, transplants, to cure conditions. And it's important. And we cannot survive without that. But what has happened is that the world around us has changed. And some people may say we are in an environment now that is encouraging social isolation, encouraging because of the internet and the way children and some adults just interact with social media, not in real time, because the food that we have, there was a lot of effort back in, if you remember, I don't know how old everyone is here, but back in the 80s, no fat. Remember, because we learned and thought at that time that was going to lead to cardiac disease. So what happened? We got snack wells and all sorts of food that had a lot of sugar in it and a lot of processing, but no fat. And so we created this food industry that is processed, that is tasty, that, by the way, is some people call hyperpalatable. Sugar on top of salt, on top of fat, called a hyperpalatable. Think of a French fry. And it hits the reward system, nucleus accumbens, substantia nigra, dopamine gets out and it makes you feel good. And it's your reward. You want it again. So what's happened is we now live in a world that's very different than the 1900s, 1950s, and we need a different medical training to actually address what's going on now. And what is that medical training going to involve? Lifestyle medicine, bringing us back to basics, which is research, though, research back, not just walk more. In every yes, actually walking more, by the way, is good to do. Yeah. Sitting less and walking more is good to do. But in lifestyle medicine, we would talk about how much are you doing now? What do you like to do? Oh, your foot hurts. You can't walk. Okay, what about a bicycle? Can you get on a stationary bicycle? We really work through it with the patient to get an individualized prescription. Now, this takes time, and this is not skills that I was taught at Stanford Medical School in the 90s. We have to bring these new skills of behavior change. We also have to bring in the latest about exercise, nutrition, and, by the way, sleep to medical school. And that is because we are sleep deprived as a nation. Because why? We are working all the time. We are on our cell phones. People are on all through the night, either working or on social media or whatever the world has created for us. We must change this. We must take control and change this. Get back to basics.
This is great. A really rich discussion. We will share the program information page and both your and my profile so they could follow us on Twitter and LinkedIn.
Thank you both for being here and taking us through this discussion. It's been an absolute honor learning from you both and from all of you here in the audience, an honor learning shoulder to shoulder with each and every one of you. If you're interested in learning more about additional sessions like this, learning opportunities, programs, and of course, this program here, Health and Wellness, Designing a Sustainable Nutrition Plan, please do let us know in the question box. You can also use the QR code or the link here on your screen to go over to the course page where you can learn all about this program and other opportunities. So we invite you to do that here. But for now, let's start from a general base here. So two questions that I'll combine here. One is, how do we further support the prevention versus prescription or treatment approach as healthcare and fitness professionals, the secondary question, and perhaps is a bit more broad, but what do we mean by lifestyle medicine? So as we seek to further define what is lifestyle medicine, what do we really mean by that? How can we also be thinking about a sort of the shift in focus around prevention versus prescription?
Great. Yes. So we would love to be preventing that in lifestyle medicine. We would love to prevent this onslaught of diabetes, heart disease, obesity, high blood pressure, dementia. And instead of treating, or as you're saying, the prescriptive part of medicine, let's get to the prevention. It's as if you have a faucet running, right? And the sink is overflowing. It's overflowing, and everyone's just mopping up the floor. And we continue mopping up the floor. But no one's addressing the clog in the drain that's creating this overflow of water. And that's what we would like to do: prevent it, get to the root cause and prevent it. So yes, with prevention, we know the power of exercise. Someone initially in the question, it was fitness, I believe, and physical activity. And we do know that exercise in and of itself has been compared in meta-epidemiological studies to medications. And for example, with stroke and mortality risk, if we can get stroke survivors exercising, they're much more they are less likely to die and less likely to have a second stroke. And this is the way we would prevent the second stroke. Now we want to prevent the first one. So getting 150 minutes of moderate intensity physical activity each week is a number one way of preventing. That's number one. Number two, try to get at least five servings of fruit and vegetable each and every day. Number three, sleep 7 to 9 hours. That's the sweet spot. American Heart Association, cardiologists, we've looked at this for our number one killer of heart disease. Those that are most likely to die or have a cardiac event are those that are sleeping less than 7 hours or more than 9. So prevention tip number three, sleep 7 to 9 hours a night. Then make sure you're socially connecting. You must. It is an unhonored pillar, this social connection. We must reach out to friends. It's best to do it every day, at least 7 times in the week, for your health, your happiness, your well-being. And then learning stress resiliency techniques, 20 minutes. So if you can, you could do yoga, tai chi, you could do meditation, deep breathing, relaxation response, but getting up to 20 minutes a day. And lastly, no smoking at all. And now with alcohol, you remember the American Heart Association says, if you don't drink, don't start. If you do drink, limit yourself to 1 for a woman and 2 for a man. If you look at the latest Lancet research and article in 2023, the recommendations for prevention, we're doing prevention of cancer, are 0. There is no amount of alcohol that is safe if we're looking to prevent cancer. So these are our top 6 prevention tips, tools, techniques for in lifestyle medicine. Lifestyle medicine uses these 6 pillars that I just gave you the guidelines and best tips for prevention on. They use these 6 pillars to reach optimal health and wellness at any age or stage of life. Stroke survivor can use this. A teenager can use this. A mom.
Can I ask, is there a prioritization of the 6 pillars?
Yes. So people ask that all the time. Physicians ask it when I give the same lecture to physicians. And it really does depend on who's in front of me, because look, if the person in front of me is struggling with alcohol and they are diagnosed with alcohol substance use disorder, then honestly, we need to address that. We need to work on that. We need to get that person into a rehab and recovery center pretty much first. So if the person in front of me isn't sleeping at all, but they're eating really well and they're trying to exercise, but they are not sleeping, they're having trouble sleeping, getting to the root of that, which may be stress. So for that person that's not sleeping at all, the priority might be stress resiliency. So it does truly matter who's in front of me to answer this question. All of these 6 pillars are powerful, and reaching those guidelines and thinking about the tips I just shared are important, and thinking to yourself, where am I lacking in that? When I look at those guidelines, where am I struggling the most to meet them? And then asking yourself, what do I want to change? Because part of this lifestyle medicine is change, and change is hard. If the person says, I really feel like starting walking because I think it'll clear my head, I'll get out in nature. I heard 120 minutes of nature time each week is healthy. By the way, that's true. Getting out in nature 120 minutes is healthy for you. So I want to get out and start walking. Well, then that's where their energy is. So that's where I'm going to need to go with them. And we'll set SMART goals each week, and we'll move forward. So probably understanding the power of each of the 6 pillars, and getting to know the person in front of you, and approaching them with a behavior change lens, a coaching lens, which we do talk about in this course, and moving step by step. I hope that helps.
Yeah, it sounds like empowering them to guide along the journey and what they're most excited about, as well as being able to be the one in charge of that pathway. So as we think about making a difference for folks more broadly, and we also think about technology and the ways that we are advancing programs like this one here are available so we can cross collaborate. So are there apps that are your favorite? Are there ways that we can help empower folks by using these highly tailored? It sounds like what you're saying is you have to think in a highly tailored way about who's in front of you. So are there any tools out there that you would recommend or that are your favorite or that you're using now?
Yeah, great question about apps. And I will tell you that this is an area of active research and really explosion on the market. So I do advise some companies here. I know a little bit about the areas, but I will just share broadly, each pillar has some pretty great apps. For example, I was just in a community of physicians I mentioned, and we were working on wellness for the physicians. Many of them were using MyFitnessPal. That's an old one. That's an old tried and true one. But you know what? People still love it for doing their nutrition log and doing their fitness. And then for this very important pillar of stress, resilience, and reduction, calm, headspace. The Peloton app itself has a stress reduction one as well as activity. So there are many apps out there to choose from. I don't have a grading system for them. I take the approach of give them a try.
So as we sort of drive down into this program itself and some of the highlights, it sounds like those frameworks as you step through from week to week are going to be fundamental in helping folks to then apply that in a more broad sense in their own professions, industries, and functions. As we're thinking about the course, is it okay for a beginner to take this program, or is this more suitable for doctors? And then extending beyond that, lots of folks here wondering, what does it take to really get started here and getting certification and really taking that next step? Starting with, is this just for beginners, or have you sort of designed it to be experience agnostic? Could you talk a little bit about that, and also next steps in certification?
Yes, definitely. And this is a program for all. And how can that be? In 2014, that's how I started. I started teaching at Harvard Extension School and created a semester long college course, which is at the Extension School. So physicians could take it, nurses could take it, college kids could take it. So for a decade, I've been targeting courses that will reach people of varying levels. Now, how is this possible? Because you'll start with the basics, and that's what I'll do. We'll review the basics. So anyone who is proficient in something will say, okay, yes, that makes sense to me. We will always give resources that will allow for a deeper dive. Now, someone who's novice won't likely go into the deeper dive resources. They'll stick with the plan, the course material as is. They won't do that deeper dive, but we will always give those that have experience the opportunity, the path to go a little bit deeper. And I will speak about more medical terms. We will cover some, in fact, cases in this course about patients. And so you can walk away saying, I have a patient like that. And now I know if I use mind-body practices, that diabetes patient might be able to drop their hemoglobin A1C by 0.87% or whatever the latest research was showing. But if you're not a practicing physician and you go through those cases, you'll say, wow, sleep really had an impact on that person's outcome. Oh my goodness, I didn't know sleep could impact insulin sensitivity. I didn't realize that. So there will be ahas for people at different parts of the program, depending how much experience you have. So health coaches, mothers, practicing physicians, that you could gain from this. If you have no experience in lifestyle medicine and you're a physician, you're going to gain a lot. If you have some experience in lifestyle medicine and you're a physician, you may well still gain quite a bit.
Great. Thank you. Just a reminder, and I put it here in the chat for folks to learn more specifics about this program, certifications, a lot of curiosity on next steps in your learning journey. We do have program advisors. You can schedule an appointment with an advisor and they can talk you through some of these program elements as you think about the logistics, registration, enrollment, and other opportunities to learn more. Back over to you, Dr. Fries. You took this journey and you shared a lot about your personal journey here. What is the biggest piece of advice that you would give folks who are just starting out in this pathway, looking to become certified lifestyle wellness advisors?
First of all, welcome to the passion-filled, purpose-driven community of those in lifestyle medicine. We range, as we say, from health coaches, nutritionists, fitness professionals, to intensivists, to cardiologists, to radiologists. So welcome to the community. And we are a team. It is a team approach. And keep an open mind, curiosity. We are evidence-based. So looking at that research, interpreting the research. If you're just new to the journey, I would say the Lifestyle Medicine Handbook is a great place to start. I did do a program and get certified in coaching in 2008. So I think there were 2 or 3 of us nationally who were physicians who then also got training in coaching. And then I've taken about 4 or 5 other ones, and I've, over a decade or more, gotten certification in motivational interviewing, looked in appreciative inquiry, and studied a lot. This is all based on your comfort level. So if you want to do a coaching program and get to feel more comfortable with assessing readiness to change, with motivational interviewing, then this course could actually help you, because we do a lot about that. We do cover that quite a bit in this course. But I would encourage people to embrace lifelong learning. So if you're in lifestyle medicine, you're going to be a lifelong learner. So if you're going to join us in this journey of lifestyle medicine, we want to be able to stay up to date. We want to be curious. We also want to be collaborative. This is a collaborative group. So we're going to bring in all parts of our team. Remember, health coaches, social workers, therapists, dentists, podiatrists. We definitely need people out there changing policy. I've been sent to Washington, D.C. a few times as the president of the American College of Lifestyle Medicine. And I enjoy that work, sure, but I'm an educator. I think there's other people that really like policy and policy change and getting into Washington. And if you're one of them, we need you. So join our team.
Thank you for putting this program together. Certainly needed as we think about how this program provides folks an opportunity to collaborate, to get to know colleagues and peers from all across the globe, doing this work from all different angles and perspectives. This is a truly a deep skills building program where you're going to be able to apply as you learn, as you go, build those connections, and really become a lifelong learner. With that, we're going to close out our time here together. We would love to hear any closing remarks. Renell, I'm going to hand it over to you to kickstart closing remarks as we say goodbye.
Thanks, Marie. I just want to close out with a couple of thoughts of gratitude to be able to share the wisdom of Dr. Freitas and others in the field that she's the conduit for, and really grateful to see the interest in an area that is so critical for a healthier world, healthier population. So I'm really grateful that so many people are showing that interest. Number 2, I'm very grateful that an institution like Harvard is now more accessible to people globally. We've removed the barriers of time, space, and to a great degree cost to have access to the best in the world, wherever you are. And you have people like Dr. Freitas and Harvard Medical School delivering programs of this nature. So very grateful for the interest, very grateful for the work that we are able to do together to create access to these programs. Beth, any final comments?
Okay, terrific. So what I would ask everyone to think about is Gandhi's quote, "Be the change you wish to see in the world." So I think about this a lot, and I want to see more health, more well-being, more loving kindness. So I think to myself, what can I do? What's in my power? How can I change so that I will be able to spread that and be that? Thank you so much for the honor of being here.
And thank you as well. With that, we sign off here with a heartfelt good morning, good afternoon, good evening, and good day to all of you from around the globe. Thanks again for joining, and we'll see you soon. Bye-bye.